Namaskar. We would like to welcome you all on behalf of Independent Research Ethics Society, AYUSH Samriddhi International Webinar Series at milestone of 2902. Thank you, thank you, thank you very much, sir. Number is not important, but your blessings are definitely always important, due to which we have been able to touch this milestone of 2900. Thank you, sir. Thank you, sir. Right from the beginning, respected Dr. Vishnu Prasad Sharma, sir, has given his blessings, and he is pillar of Ayush Samriddhi, and my avatar, sir. Oh, great entry. Great entry in the picture of Ayush Samriddhi, sir. Really, both of you are unique figure. Sir was principal in Guwahati Ayurvedic College, Government Ayurvedic College, Guwahati. He is professor also. And you, today's speaker, our Dr. Avtar Singh, sir. नमन है, बंधन है, अभिनंदन है. So, to welcome respected Avtar sir, I would like to request Dr. Vishnu Prasad Sharma sir. Welcome, sir. I welcome you to welcome Avtar sir. Jai Ho.
Namaskar, good evening to everybody. Respected Pawan Kumar Sharmaji, distinguished guests, ladies and gentlemen. I, Professor Dr. Vishnu Prasad Sharma, welcome Dr. AVTAR Singh to this AYUSH Samriddhi International Webinar Series. Today, we have diabetes and its management. Dr. AVTAR Singh will be explained regarding disease management, everything. I welcome Dr. AVTAR Singh to speak few lines. Namaskar, over to Pawanji.
Avtar sir is great personality, sir. I have seen his miracle there. Great means a big clinic with Ayurvedic medicine, pure Ayurvedic medicine. Generally, he is not using proprietary medicine, and he is preparing his own formulation to treat the diseases. Really, sir, I have not seen this type of clinic with 99% Ayurvedic doctors. So, I welcome Dr. Avtar Singh, sir, for his views on diabetes.
Thank you very much, Dr. Pawan ji, Vishnu Prakash ji. Dr. Pawan, क्या जब बात करते हो ना आप, क्या जवाब नहीं आपका. ऐसे चक्कर में डालते हो बातों को भी. आप यूनिक कहते हो मगर एंटीक शो करते हो. और हम खुश हैं कि हमें कोई एंटीक भी समझता है. एंटीक की ज्यादा वैल्यू होती है. तो हम इसके बारे में आपको बधाई देते हैं, आपकी समझ को, आपके ज्ञान को, आपकी बातों को. आप आए, हम अभी तक याद करते हैं आप जब आए थे बड़े प्यार से. तो आज का जो विषय है जिसके लिए हमने टाइम ये निकाला है पब्लिक के लिए, डायबिटीज, जिसको प्रमेह बोलते हैं, मधुमेह बोलते हैं. It's the biggest problem at the moment in the world. No one take it seriously. This kind of disease, you can call this one disease mostly because we have to give the name, although I don't believe they are disease. Whole world is saying they are disease. But according to my treatments, my research, these are not the disease. 2 years ago, this one clearly said in the Dubai conference, when student asked me, how you treat the cancer or autoimmune disease, I say, first take it out from the brain. In the Ayurveda, these are not disease. This is the Ayurveda say you are unbalanced your body. Long time ago, when Ayurveda starts, they come in the script that one, some people say 3,000, 5,000, but Ayurveda was before that one. Ayurveda script come that time. Ayurveda is not the recently developed that one. This science is come from Vedas. They come from great saint who wrote all things. It came from Brahma. Brahmaji, all Gyan, the Vedas Gyan, he wrote it, that one. Is people think these are disease from last 50 years. When the written Ayurveda, they clearly also mention the Madhumeha. 18 type of mehe in the Ayurveda, different type of, they call mehe. But Madhumeha, which the sugar people call nowadays, diabetes they call nowadays. This is not the came from somewhere else. When we have the main 7 ashyas, this is a problem from those ashyas. I many times said, if we look after our internal system, biggest system is the ashyas. Those ashyas, when toxified, then so many disease start in our body. In English, they call disease, we say rog. Become out of control. What is the sugar? What is the diabetes? Pancreas is not controlling that one. Now we have to find out what is the reason pancreas is middle of amasya and liver. Nothing go directly to the pancreas. Directly, nothing reach to the pancreas. So why pancreas become the problem, start giving problem or gone into that problem? Why? Pancreas is not the starting of the anything. Anything we eat, we drink, we take it orally. This is all the system become wrong when we orally taking and not the suitable for our body. There's the biggest problem is gut. 80 to 90% nowadays, diabetic people, they don't have pancreas problem in the beginning. In the beginning, all my qualified and very experienced Ayurveda people, my colleagues, maybe they're watching, maybe they watched after that one. I'm talking about how I treat the diabetic people. I'm not just giving the knowledge. What is my experience, I'm sharing with that one. How I treated many diabetic people, which way I treated, what I done first, what I diagnosed, that is the most important. I'm telling 80% people, we have to take the history and to what is the starting. when the diabetic, then it's not one thing is problem, that any diabetic person definitely have they call liver fatigue, cholesterol, blood pressures, low or high, doesn't matter. And also, they also have the gut problem. 20% diabetes, pancreas. Pancreas is a gland and also organ. They work both way. When our endocrine system, gland system is disturbed, when this system is okay now, then our pancreas come in the trouble, because our hormones are not working properly, not giving message properly to liver and stomach to control the sugar. Pancreas not controlling the sugar. Pancreas cell controlling that one. Liver is controlled for that one. If gut is problem, not proper mineral, not proper enzyme go to the liver properly, then liver can't control this thing. They have to work hard. They can't control the sugar. Some people, if you take in more than suitable for your body sugar, sweets, then also you can get the problem. There's many reasons. We have to find out, monitor that one. What is the diet patient's taking before come to you? What is the reason? Maybe he have the side effects, maybe he is alcoholic, maybe he have some other problem. Many people start diabetes problem after the malaria, after any flu, that one, because they took so many medication, they make the pancreas or liver. Liver and gut are both responsible for that one. Then pancreas becomes the problem. Pancreas is a very sensitive organ. And other biggest problem, we have noticed all the Ayurveda people, any diabetic medication in the Ayurveda, no need to mention that one, all are bitter. Not anything sweet for, we think, just give the bitter medication because sugar can come down. No. People start thinking because sugar is the problem, add the bitter thing in the body. Nothing wrong, but that is not only the solution. Not only that solution. We know there's nearly hundreds of medication, the bitter medication. I seen so many people on the media, they're throwing their formulas. Take this one, take this one, take this one. Oh, you be okay. They are claiming you can become the okay, no any diabetes. You can cure your diabetes. I don't understand those people's mentality. They don't know what is the reason the pancreas gone down or collapse or stop working. What is the reason? If they're giving too much bitter thing, most of the bitter medications are pitvardhak.
আৰু এনেও কবিতা আছে নেকি মানে বেলেগ এনেকুৱা কম লাইনত থকা?
This is the problem. If they too much pitvardhak to give them, then digestion becomes the problem. Then liver become more problem. And person maybe can't sleep properly. No, that is not, I'm not doing that way. We have to be monitor what is the reason. If liver, definitely liver is that time, any diabetic person, liver definitely giving them problem. Gut, they have the problem. You have to be sorted out first gut problems, liver problem, pancreas starts slowly becoming normal. Just give the medication for the pancreas. Pancreas, and third biggest in my treatment I shared today, in our all the ashias, as I do the full detoxification of the body. You need full detoxification of the body. All Vedya can do it. They can find out not only stomach or some massage therapy or something. They need to be clean all body from toenail to head. When people are stage 4, I call them stage 4 diabetic people, when they're taking so much triglyceride or they are edge of the go to the insulin, that's not the beginning. And people still who throwing the medication on the media, and people say, oh, we use this medicine. People come to me, they say, we try that, these things not work. How can they work? Okay, maybe those are not the, I say they're doing this, they say doing charity, but I don't believe them. They're doing charity, they're damaging more. If the diabetes 2-3 months you not control, they become the problem of the heart, kidneys. And people on the media, they're listening, start buying the big container, filling, they're doing every day, using years and years. After that one, still they got the kidney problem, they got the heart problem. Their oxygen level become down, they have the big problem. Then they say, we try Ayurveda medicine. That is not the Ayurveda medicine. That is the Ayurveda herbs you're using without prescribing, without professional contract. Ayurveda is also the like other doctors, other therapies, Veda or Ayurveda, same name. You have to be consult somebody that if the professional Ayurveda person, go to them. If you have any health problem, don't do media remedies. Okay, you can try 1 week or 2 weeks. If you don't control, don't waste your time. And then after 2, 3, 4, 5 months, when your problems become big, then you say, you try Ayurveda. That is all fraud. That's not, don't make the Ayurveda name bad. Ayurveda, if you use any Ayurveda practitioner, then you can say, I try to Ayurveda practitioner, but my problem is not solved. There's maybe one other issue. I always say in my lectures, take your report, go to your any own Ayurveda doctor, Ayurveda practitioner. Ayurveda practitioner is a physician who know the job, who doing the practice. There are 2 types of Ayurveda doctors. I'm calling about the physicians who doing the practical Ayurveda. They are both respected for me. Some know the medicine, some know the problems of the health problems. They are experienced. Everybody need experience to do the treatment. Treatment is not like a little thing, because inside what is going on in your body, not everybody can find out, not everybody can diagnose. If you want to be the proper treatment, go to the proper physician who practicing. You can find from the public, they can tell you, oh, that physician, Ayurveda doctor is good. Yeah, nowadays everybody can very easily can find the good Ayurveda practitioner. Should be qualified physician. If you go to reach them, he can give you the more help, more quick relief for the diabetes. Other things, anything, he's a specialist, he can do it. And most of them who are proper physician, they are very straightforward. They are very good. They know what they're doing. They don't want to make their name bad, somebody. And they love Ayurveda. I know that so many people, they're doing that one. In our mind, I always say, should be Ayurveda is first for us, then is our work. If you find a practitioner like this one, a physician, they can help you. If that practitioner don't give you the result within 2 to 4 weeks, then you have to change the practitioner. That physician either not understand properly, either not using the proper medication. But in the Ayurvedic medication, like Pawanji seen in my, how I'm giving the result. I can buy the so many companies, they can send me the ready-made. I use in the beginning. I'm not against them, but I'm not happy with them. I told so many times on the video, I don't have to shy to say this thing. Pharmaceutical company not making proper medications. I don't bother what they think about me. I even tell I'm a request to Indian government, please control them. If they make the proper medication, we don't have to make that one. Even Indian classical formulations, they're still working. We using that one. Okay, I'm a researcher, I make my own formulations. Many things I designed to how to full detoxification of the body. Anywhere they can do it. If you work a little bit their sense, they can do the which area is toxified. As I told you, the saptasya, sapadhatu, the waste of sabdhatu, we have to clean that one. What is the pancreas? Pancreas is asya. Agnasya, we call. Agnasya is toxified. He stopped working. Toxified means there are a lot of rubbish in the Agnasya, maybe bacteria inside, maybe parasite inside, maybe a lot of mucus inside. Their cell is not working there, what I found. I seen with my cleansing, full body Saptakarma cleansing, the results start within 24 hours to 48 hours. Why? Because I use that medication with the whole body cleansing, not clean. If you clean only stomach, if the pancreas, Agnasya is not cleaned, liver is not detoxified, they can relieve your digestion system, maybe less bloating, maybe less gas trouble inside, maybe less pain. But other asya you also have to be looked after. There I designed the system. How can you clean your full body? Not only these are, because especially they also related with our nervous system, endocrine system, glands. So all become the toxified. Toxin not stay in one place. Our blood try to move from there, pass through the urine for the sweating, for the poo, and this one, bowel movement. But how big oxygen cell, our blood cell can carry that toxins? They are very small cells. They take limited things. They're cleaning all the time, every day, 24-hour whole life. If you build up too much toxins in your body, then they can't have, you need special treatment. Why we give the panchkarma? No need to vomiting, no need to vomitation or basti or anything, because the toxin is too much on those areas. Amasya, Malasya, Adumasya. But the three things can clean with the Panchkarma. But with the Saptakarma, full all the 7 ashas can clean. Not 7 asha, all mal in the Saptakarma, Sapt Dhatu's mala can clean. Because I made this one carrier through the blood. My medication reach to, until your medication not reach to the liver with the enzyme, they can't go into the blood. Blood is made by liver. He purifies, then go everywhere in the body. That is the I call the full body detoxification. Nowadays, we definitely have to think about, if we want to any chronic disease, which one giving problem to the whole world, you need to be full body detoxification. Anybody can do it. All Vedas are saksham for do this one. They are very qualified. I respect every Vedas. Why this problem was more before 50 years is not people have. I ask the question today, and I give after 15 minutes to the people. Anybody can ask a question to me. Simple question am I asking every Ayurveda practitioner nowadays. Many people they are too much thinking, why 50 years ago we don't have these kind of disease, these kind of the health problems? And their theory, old Vedas theory, we call Siddh Ayurveda. I respect Modi ji and salute to them, because new Ayurveda practitioners, I don't have to shy to say this one, who learn from the universities, they don't think old Veda were qualified, old Veda were skilled better than them, old Veda was can do the treatment. They thinking, all they learning all Vedas written, Chark, Shushut, Bhagavad, Ashtanga, all these are old Vedas. They're doing in the Gurukuls. Nowadays, they gone to the like allopathy big university, they call the system become like allopathy universities. And they think in the people go to the university, they learn theoretically something, not everything. I met so many people. They think they are what they written, but they forgotten all their reading, all their learning, all their listening, all told the Siddh Ayurvedas. Chark was Siddh Ayurveda practitioner. They are coming generation and generations in the any treatment, any health system. Allopathy never say old. Allopathy 175-year-old. So many universities become nearly 100 years ago. Before that one also they do something. But they never criticize their old doctors. But our Ayurveda people criticize too much. They think they become the superior. No. You forgetting. Your genes come from those Ayurveda people. You are Nadi student, Nadi sons of the old people. Your parents gave you the birth. But Ayurveda, you learn from the Nadi. We Nadi. We are all Nadi Putra of Chark, Shushat, this one. The generation genes coming. Ayurveda is like a gene should be in your body, should be connected each other. When your link is broken from your genes, then you can't learn because you become ego in such. When you say, what Chark say, learn this one. In your area, any old Veda, go and sit down with them, make their group and ask them how you was doing. Why not 50 years ago like this problem? Now is million people are qualified, but people are still not getting enough benefit. Patients are not still confidence have to go to Ayurveda people. Why? If we do the proper Ayurveda, I was in the university last in the summer SGT University and some Pune and three places I done the lectures there. Dr. Anil Sharma, Dean of SG University, and Dr. Raghunandanji, and in the Pune, Dr. Khambe. We went there, and I said this one. After many years, Dr. Khambe was agreed with me. Dr. Joshi was sitting. What I told them, this is the reason we getting the problem. Take it out from the body, your body start working again. Like your sink is blocked, your pipes are blocked. When you clean that one, everything becomes the smooth. In the old time, in the farm, we working that one, water come through the well. And we do that call, we call the small, where the water is going. If the lot of patwar, there are a lot of grass, there water not run properly. We have to be clean that one. Same is body. We have to take arteries, veins, clean all the time. That time was not very toxic thing we eating. Number one is good thing. But now are more toxin than nearly 80% food what we eating, air pollution. So better for if you want to do the treatment for the Ayurveda, through the Ayurveda properly for the diabetes is reversible. I can say curable. If you get rid from the diabetic medication, it's mean cured. But you have to be monitored. Depend on the how much pancreas and liver you damaged before. Take long time, but you can save your body's other organ. No need to side effects medicine who have so many side effects that there's no any medication in the world they say can cure the diabetes. But I'm agreed with them. But if they're not cure, why you giving the whole life that medication and damaging other organs? I have no any objection. Take the medication for the diabetes. Okay, pancreas is not working. It's okay. Why other organs are damaged? That is have to think about that one. Now, with the Ayurveda, what you damaged already, we can reverse that one too. We can help your body. If you damage 40, 50%, 60% your organ can rejuvenate it again. Because all our body, I'm sharing this one with the practice, with the proofs, our body, until we are alive, repairing themselves and looking after themselves. All the organ, they are very, very strong nature made. So better when you have any health problem, diabetes, especially we're talking about that one. Number one, you want to try media remedy doctors, I call them. Try it, but not 1 or 2 weeks. If you get benefit, I don't know how qualified they are. I don't know they are Siddha Ayurveda or many people are well known. They're giving on that one. I'm not giving the remedies because I always make the custom-made medication. What Ayurveda say, I'm not doing that one. What is the Ayurveda's rules? I follow 100%. Please, I also request to all Ayurveda practitioners, don't try this one. Even I request to India government, stop these kind of the media remedy doctors. Can't give any remedy to anybody. They maybe 5% get the benefit, but 95% get the problem. Delay is also problem to get more disease, more bumari, more problem for health problem. So better they go to quality. Have you noticed in the allopathy, they are great people. They're doing their job very professionally. If you go to any allopathy doctor, they won't give you any remedy. They prescribe you the only our people. They think they're making their name. They have some people have the thousands of followers. Thousands of people, they views they say, oh, I have the 100,000 viewers. What does it mean the viewers? How many cured? Should we count those are? Viewers are, because people are, they want everything free. And they are looking. And only, especially our culture, I don't have to feel shame on this one. Our culture people, they all want to anything for their own benefit. They don't bother that one. They're looking after, we have to save this money, save this money, save. They're not looking after their own body. Their biggest enemy of their own body. That is our people, our culture. They think, I don't know what is the mind on that one. They're very intelligent people. Also, they do this same mistake. They should look after your body first. Your first, if you got any problem, that's no problem. You need proper person, proper mechanic to make your car again, run again on the road. Proper doctor, proper physician, they can make your body run again. Your body. If you don't do that one, you're in the trouble. Unnecessary, you damage your system. As I said this one, if you have, I give the little sign. If your digestion is giving a problem, your liver appetite is going down, you not passing your bowel movement properly. If you are feeling thirsty at night time, feeling all the time tired or cramps, not sleep properly, better do check up your blood, find out what is the cause of that one. So many our organs, they have the very good system now. You can find out which organ is going slow. The problems come both ways. If the organ going slow, then you have the problem. They make other organs disturbed. If they're going overactive, you also have the problem. Do the balance. That is only professional people can do it. Please don't be, in our language say, conjuice. Spend something on yourself. Even if you save 2% your wages for your health, 2% is nothing. Even 1%, I many times I said, in UK, I say, if you collect £1 every day, in our country, if you save 5, even 2 rupees every day, in the year you can make 700-800 pound. And there is, you can do the blood check once a year. Or if you have the problem, definitely over 40, definitely everybody have to blood check. Everybody have to monitor their body. And everybody don't eat which food you can't digest. That is the simple way to look after yourself. If you look after yourself, diabetes is reversible, as I said before. You can save yourself, doesn't matter how much foods are bad. Don't eat bad food. Try to eat a home-cooked food. Don't show off to the people. Buy 2 shirts, 3 shirts, 2 pants, less than a year. Don't show off. Don't buy the expensive clothes. Look after your body, which your body, your own health, you can enjoy. With the money, you can't enjoy. With the money, you can't live good life. With more money, you can't do it if your health is not good. I always say health is wealth. Look after your health. Diabetes is not the big problem. Problem is how we handling that diabetes. As I told you, if there are these symptoms in your body start giving symptoms, very intelligent. They call body symptoms, lakshanat we call. When we ignore them, if we feel tired, we taking multivitamins. These things that I've seen so many people, they are gone sky high. They are vitamins. Unnecessary they're taking. Don't take unnecessary. Do one blood checkup. Spend some money on the checkup. Go to any proper physician. Give him fee. He can diagnose for you. He can tell you this is your problem. Don't take everything. Maybe you're spending more money on the vitamins. And also health still giving you problems. You can't work properly then. If you're losing your 1 or 2 day week from the job, you lose the wages there. If your health is okay, you can work, no problem. You can do the extra work there, overtime. Just think positive way, think proper way with intelligence. If you do that one, I'm sure definitely we can fight with the Ayurveda, with the diabetes, not only diabetes, any other disease. What I'm doing for the Ayurveda, how I'm treating, how I'm getting a result of the Ayurveda, this is my teaching to the people. This is my system. I find out properly, diagnose what is the actually reason, which organ is not working. Just only professional person can do it. Not every remedy can suitable for everybody. Not those remedies you don't know that, as I told you, is which organ, as I told you, is not properly overactive or underactive. Both type of system, if you go disturb, pancreas is sitting in the middle of the metabolism, the digestion and liver. They are confused. Then pancreas gave up. Maybe pancreas have a lot of parasite inside. That is also biggest problem. That is in Ayurveda say bitter herbs are killing the parasites. Everybody know. And but until that parasite not go from there, from the body, you can't remove from the body. They can't go easily out. Doesn't matter how bitter herbs you can giving them. Bitter herbs also can give the problem to the liver. Maybe urinary tract, okay. Compet is verdict, then it's maybe you have the kidney problem, urine bladder problem, prostate gland problem, other health problem, heart problem. So please don't do self-diagnosed. Don't listen remedy doctors. Go to your areas, good Ayurveda practitioner. As if they're not giving you the results within 2 weeks, then you need to change the doctor. Not blame to Ayurveda. Mean that Ayurveda doctor, as many time I say, go to the Ayurveda doctor or allopathy doctor. If he can't tell you what is going on in your body, because you know what is going on in your body. You know what is the symptom you're getting. Doctor don't know. You are night time 4 or 5 times going to pass the urine. Who telling the doctor? You told. No, don't tell him. When he checked, if he asks the question, then means he know the job. That practitioner, physician, doesn't matter, anybody. I'm definitely say, when he tell you the 50% of your problem without you telling, then he can give you the relief of any disease. My friends, don't, it's your choice. If you don't find the good mechanic for your car maybe little thing need to change. If you go to any stupid mechanic, then he can say, try to change this one, try to change this one, try to do this one. Can you do it? You don't do it. Your body is the biggest mechanism system inside. It's running without the petrol, running on the food. Cheapest thing you got it, but it actually is very expensive. You think, oh, doesn't matter. Most people abuse their life, abuse their health, abuse their body system. Don't do that one. If you want to stay healthy, if you want to avoid these kind of problem, please look after what I said to you today. Then diabetes can reverse and you can live good life without any further damage. Hope this one is you listen that one and beneficial for you. And thanks very much, Dr. Pawan and हमारे मित्र अदर जी डॉक्टर हमारे साथ आज बैठे हैं. दूसरे दोस्त पता नहीं और कौन है. So I wish you good luck, everyone. And if any question, I'm happy to give the answer. Thank you very much.
Thank you very much, sir. Thank you very much.
You're welcome.
With your kind permission, can I present something, sir?
Yeah.
Thank you, sir. If we talk about Madhumeha, diabetes mellitus, you rightly said, this is lifestyle syndrome, I can say, not disease, because that is asya sukham swapna sukham dadini gramya daka nup rasa payansi. So Madhumeha is used with, but it is the Vataj Prameha, Madhumeha if we talk. That's why it is critically means difficult to treat, because it is Vataj Prameha. It is Kafaj Vyadhi, but it is Vataj Kafaj Vyadhi. So both treatments are controversial or contradictory, we can say. Literally, pra means abundant, meha means passing off, large quantity of urine. I see it like large quantity of any secretion, oj meha, shukra meha, not urine only. It is not based up to urine, but it is the over excretion of any liquid from our body. I can say, I have observed this because Chandraprabhavati type medicines are useful in any secretion from the body. So, Ikshume, Sitame, Kafajme, I am not going into the detail, but etiology is very clear in this modern era. Asya sukham swapna sukham dadini gramyo daka nup rasah payansi navanna panam gunavekritam cha prameha hetu kafakratcha sarvam. Just our Maharshi has written the fact or prediction like Baba Benga, what we are facing in this modern era. Sedentary habit, dahi, yogurt or curd, whatever you can say, meat juice of domestic, aquatic and swampy animals, milk and its preparation, newly harvested cereals, new fresh wines, preparation of jaggery, and all other cough aggravating factors are the causes of diabetes syndrome. Dosh, cough, pitta and vat in sequential order. First cough, because all factors are aggravating cough. Then pitta for dysfunction of metabolism. Agni, pitta is agni. And then vat. So vat is definitely, because we are observing without neurological dysfunction, it is not complete. And dusha is rakta, shukra, and ambu means body liquid. Vasa, lasika, majja, ras, oj, and mans. See the occupation or see the chronicity of this disease, because it achieves each and every ashay of our body. I am not going into the detail because this is not samprapti. Nidhan sevan, then dushti, dusht dosh, apart med dhatu, med villian due to pitta. Pitta is important for med villian solution. Kled vradhi, extra kled shift to basti. Then this is related to urine only, diabetes only. This Madhumeya, one of the Vataj Prameya. Kshodra mein hai, Ojo mein hai, everything we can say, but ultimately Madhumeya is the result of our Pragya Parad in modern lifestyle. All we are doing. Snigdha, Sheet, Guru, Pichal, Madhur, Lakshana, cold water with our meals, unwanted, untimely meals. So these all are factors to create diabetes or initiate diabetes in the body. It is not clear that before diabetes we can't understand. No, not at all. Purva it is the Ayurveda only science which has classified Purva also. Modern generally depends on the symptoms, but these are pre-symptoms. Anyone can feel that I will have this disease. That is Purva. But nobody is caring of that. Burning sensation in palms and soles, body, skin became anxious and slimy, heaviness in body, urine is sweet, bad in smell and white in color, yellowish in color, not white, stupor, debility, profound thirst, atitrashna, dyspnea, more accumulation of dirt in the palate, throat, tongue and teeth. Nobody cares about it. Okay, these are normal things due to our pragyaparat. What we hair of the head adhering to one another. So these all have uh, means mentioned in our text as purvaru. Maybe roop, turbid urine, profuse urine, maybe albuminuria, maybe shukra maybe ojo whatever it may be, but some secretion is there with our very long, my presentation is very long. So, what is the treatment? Prameya Chikitsa Sutra as per Charak, for obese and strong Prameya Rogi are subjected to Sansodhan. First, then Santarpan is done, where Crush and Durval Rogis are subjected to Brangan Chikitsa. So, Sansodhan is important, maybe Ashay Sansodhan, maybe Panchakarma Sansodhan, whatever Sansodhan is there, but Sansodhan Ayogya Pramehi should be treated by Sansman, means to whom which can we can provide them Sansodhan therapy. Only those can be treated by Sansman, otherwise Sansodhan, maybe Asay Sodhan, maybe Dhatu Sodhan, it is necessary. Month, Sattu mixed in water, Kashai, powder of Yava, Avleha, Lagu food should be given to pacify dosa. I've just see so many medicine are around us, but we are not taking care of that. And we are not giving importance to those that these can help to prevent and cure diabetes. Prevent, manage, and cure. Cure in early stages, but when patient is dependent on insulin, it is difficult to come out of the way, because due to insulin or due to additional hypoglycemics, our pancreas and liver are inactivated. They are paralyzed. Everybody can, yeah, human tendency is there, so organ tendency is also there. If Modi ji is giving ration in each and every home, suppose, who will work? Why they will work? Ration is coming. For luxury, they may work. But basic need, if it is being catered by the medicine, our this liver and pancreas are not working proper after taking those medicines. So please take care of that. First, try to control your diabetes or Prameya with Ayurveda, then go to allopathy. Don't try to take oral hypoglycemics or insulin in the first stage. Amalki, Haridra, Neem, Azadirachta indica, Eagle marmelos, Bilvapatra, Tinospora cordifolia guduchi, and Amalki Amelica auspiciosus, Curcuma longa. So these are swaras which can be taken to prevent if Purvarup are being observed. So be careful for Purvarup. Kwath, Bidangadi, Falatrikadi, Mustadi, Manjisthadi, Pathadi. These are the Kwath for Madhume. Churn, Trifladi, Mustadi, Gokchuradi, Arkadi. But after reciting these names for general information, I would like to request and confirm the speech of Dr. Avtar Singh sir that without any Ayurvedic doctors, perfect Ayurvedic doctors, don't try to medicate yourself personally. Ghrata are also there. These are for your confidence that our Ayurveda has vast range. It is not the matter that you can go to OTC person chemist and directly purchase it. No, not at all. Because so many symptoms are involved, so many factors are involved. Like astrologer, our body is there. So in astrology also, until and unless your kundali is not being observed by any perfect Jyotishi, you can't get prediction. So like us, our body is there. So Dhanvantri Grat, Trankant Grat, Singamrat Grat, Dhalimat Grat, Salmat Grat, so many Grat are there. Avale are there, Kushavale, Bangavale, Gokshuradi Guguli is there, Pug Pak, Paka also there. Pak is with sugar, and we are trying our medication to cure diabetes. So Pug Pak is there, Sugandhadi Pak is there, Chandraprabhavati is there, Indravati is there, Kastur Modak is there. These dosage forms are for the convenience and dosage indication for the patient. So we have each and every dosage form to take care of this. Now I come to Rasosadi and Asawarishta. वसंत कुसुमाकर रस, मेहमुदगर रस, बृहद वंगेश्वर रस, प्रमेह गज केसरी रस, त्रिवंग भस्म, बसंत तिलक रस, इन असवरिष्ट लोध्रासव, दंत्यासव, मधुकासव, देवदार्यारिष्ट, लोध्रारिष्ट. So I am repeating my words. These are not the publicity of classical Ayurvedic medicine, but it is for the confidence of every audience in our YouTube that we have in our Ayurveda each and every dosage form to treat diabetes. So many kasai, so many Sanhita references are there. Yogasanas are there. Yes, diabetic person should do yogasana. Yoga is not asana only. That is also being misunderstood by the society because yoga is not asana only. Asana is the part of yoga, and yoga is the part of Ayurveda Ashtanga in Swastha. So yoga is very small part of our Ayurvedic classics, but as no medicinal intervention is there, public has accepted this well. In comparison to Ayurveda, public is ready to accept this because no medical, no oral, no internal intervention is there for the medication. So, Uttit Trigonasan, Paribrat Trigonasan, Prasarit Pado, these also should be performed under excellent Yoga Guru. These are not menu of the restaurant that I am reciting. You go and do yoga by yourself without asking any perfect person by seeing YouTube video. It is not better for any patient, any time, because everybody is unique and every treatment is also individualistic in Ayurveda. So many asanas are there. Pranayam, Kriyas, Agnisar Kriya, Kapalbhati Kriya, cyclic meditation, Avtaran Dhyan. In Patyahar of diabetes, Shukdhanya is there. Jeerna Sali means old rice, shali rice. Sashtik rice, Kodrava, Yava, Godhum, Udalaka, Shamak. Just see rice is not mentioned, but variety of rice is mentioned like shali rice, Sashtik rice, Kodrav, Shimbi Dhanya in Chana, Adaki, Kulatta, Mudga, Shakvarg, the leafy vegetable, is predominance of bitter and astringent taste. Tiktan Kasairas, Patol, Karela, Karvelak, Shigru, Moringa, Falvarg, Jambu, Jamun, Dadim, means pomegranate, Sringatak, Singhala, Amalki, Kapetha, Tindok, Kharjur, Kaling, Naveen, Mocha. So these are mentioned in our Ayurveda. Mans Varga, Tel Varga, Udag Varga, Kirtan Varga, other. Everything is mentioned in our classical text. There is need to go to Ayurvedic person, and I would like to request Ayurvedic experts also to read our classics well first before treating the patient. It is very necessary. Avtar sir is again and again indicating to do it, to have perfection in your practice also. So Pathya Vihar, to have walk, traveling on elephant, horse means just awkward. Now horse and telephone not there, and now motorcycle is also increasing the tendency of diabetes because of, in our Ayurveda, it is clearly mentioned that after meals, you should not move on these obstacle full wage. Due because your food should be digested in nice conditions, not this obstacle filled conditions. So we are doing, everybody is not taking care of this, and the result is diabetes. Follow Sadvrita, dry massage, bath, roaming in different places than other than temples, using umbrella. Apatyahar also, they are clearly mentioned. Apatya Bihar is mentioned. So many. Like in modern, I am going into headings only. In diabetes, energy balance should be there. Weight loss should be achieved. Eating pattern and micronutrient distribution should be there. Carbohydrates, proteins, selected protein, dietary fat, micronutrient and herbal supplement, alcohol, sodium, non-nutritive sweeteners, physical activity should be there, smoking should be less, alcohol should be less. These are the treatment or factors for prevention of our diabetes mellitus. I have crossed my level lining because I'm practicing from last 35 years. Here in Kolkata, I have my clinic also. So, but more experts are here with our expert. Dr. Vishnu Prasad Sharma sir is also head of the department Kai Chikitsa. Dr. Nishant Shukla ji is also from Kai Chikitsa. But these are my views on diabetes, what I have explained. Sorry, this presentation was for approximately 2 hours, but I have completed this presentation within 15 minutes. Respected Avtar sir.
Both this you said so many things. You give the diet, medication. You show the in Ayurveda we have the so many medication to look after the diabetic person. What type of diabetic? Why in I think uh, I said 2 3 places. Why they have the diabetes 1, medication is 20. So why they made the medication, our rishis, our charkas, other jo, why they make so many medication for the liver, so many medication for the kidney, so many medication for the digestion? Because they made it a different type of the problem. They was very intense. What they done till now, we using that same formulation, same protocol. I always say, I'm not done anything new, but new problem, I try to find out, sort it out new way. Medications are same. Ayurveda medications are same. Problem is, as I say, medication, how pure and clear medication made properly. If a medication not made properly, then they never work. This is the biggest problem. And you explain all very well. You explain the diet and you explain everything. So all the patients should have to look after these things. And as you said, find the, before you take it anything, better you go to the professional, any good physician in your area. You definitely get the benefit. Ayurveda saying Madhume is not the difficult to treat, difficult, but not you can't on this one you can't be disappointed with the Ayurveda treatment. Ayurveda treatment can do the treatment for the Madhume, any may, not only Madhume. So believe in Ayurveda, but you have to find the good physician who can do the job. Thank you very much.
Thank you, sir. Thank you very much. I am grateful to you for your kind words, and kindly stay with us physically, virtually, whatever. Because now next is Kavi Sammelan on Makar Sankranti. I welcome Dr. Shiv Acharya Harwal. His Upnam is Harwal. Vaidya Bhagwan Sahib Parik ji from
जी
Administrative
सर
Services in Ayur. Welcome, sir. Welcome,
जी
Shiv Kumar ji,
नमस्कार
welcome.
नमस्कार जी जी
Adharaniya Rajkumari ji has joined. So welcome, Rajkumari ji, welcome. So please stay with us, Avatar sir.
I try to little bit. Yes,
Yeah,
definitely.
please. So for concluding remark, I would like to request Dr. Nishant Shukla ji. Dr. Nishant ji, am I audible to you? For concluding remarks of this webinar. I am not audible to him, I hope.
The mic is not audible.
Thank you, sir. Thank you. So I am communicating my best regards to you, as
Thank
well
you.
as really your expertise, your knowledge, your unique concepts, everything is admirable. Everything is admirable, no doubt. And we are really grateful to